Hi, my name is Kelly and I'll be performing the IV fluids and medication skills video. I have not received my scrubs yet or my badge, so I'm in a makeshift one. No jewelry on, no gel, no acrylic. Hair is up. So our patient today will be receiving IV fluids of 150 milliliters over 60 minutes, and also amoxicillin 250 milligrams of 100 milliliters over 15 minutes, mixed with normal saline. So when I did the math, I did 150 mLs over 60 minutes with the 15 drip factor, and we ended up rounding up to 38 drops per minute. That's for the fluids. For the medication, it was 100 drops per minute. So to get started, I would perform hand hygiene first, and then go ahead and grab my gloves to prepare everything. Gloves on after performing hand hygiene. And I have my medication here and the IV fluids, and then the regular tubing and the secondary line tubing. So with the primary tubing, the fluids, we have here the spike. This will go into the bag, the chamber, which we would squeeze. Once in the bag, we'll squeeze to get some of the fluid halfway through, and then afterward we would be able to count the drops. This is the roller clamp, and right now it's unlocked, so the fluid would just flow through fast. So what we want to do is, before we spike the bag, we want to make sure that's closed. Right here we have the Y port, where we would connect the secondary line, or if we need to push any medications through, we would push it through here as well. And then of course the connector that would connect to the IV. Right. And then secondary line. The only difference with this one is it doesn't have the Y port. It's just one straight line. We would untangle it before getting started. And it has a chamber as well with the spike and the connector that would go into the Y port. And this one we want to clamp as well for now. We're not going to mess with this one for now. So before getting started, we do want to verify the orders, have the 2 patient identifiers, and also the 6 rights of medication, or the 6 rights of medication administration, which is right patient, right dose, right medication, right time, right documentation, and right route. Okay, so once we have that down, we want to make sure that we did do the hand hygiene. We applied our gloves, and then when we go to spike our primary line, we are going to grab our tubing, our primary tubing. Again, make sure that the clamp is closed all the way, the roller clamp, so that way it doesn't drip right away. And before we spike the bag, before I even take this off, because it can be a little, I want to remove the cover of the tubing. We want to remove the cover. So we'll pop that off. And once that's off, then we'll remove the top for the spike, and we will push in. And you do have to push in a little hard. And once that's in, before we flip the bag over, we want to make sure that it's in all the way and the clamp is closed. And then we do want to hang this. So once it's hanging, the roller clamp is a little high, but that's when we can stretch out the line, and then we want to squeeze the chamber to it's at least halfway full, and then we will remove the cap, but we want to keep the cap with us. We don't want to toss it. And we'll open the roller clamp slowly. Just to prime the line, we want to make sure that we prime the tubing before applying it to the patient. So we'll open it slowly just to get the line going. And I want to make sure that my trash can is nearby so that way I don't spill any of the fluid. There we go. Okay. I want this to infuse for 38. So what we're going to do is we're going to slow down or open it up a little bit more just so we can count. So for a minute, we will sit here and count 38 drops over a minute just to make sure that it's 38 drops per minute. So we'll be counting here. And once those 60 seconds are up and we know that we have counted the 38 drops per minute, then we can stop it for now. So since we are hanging up medication, we want this to be lower than the medication. So we'll bring this down. And then once we have the antibiotic, we want to go ahead and open it. Again, same thing, remove the top. Remove the spike top second. Push it in carefully. Make sure that the roller clamp is closed before spiking the bag, which mine was. And then you want to hang this up higher. And then we'll fill the chamber up halfway as well. And slowly open the roller clamp after removing this top. Make sure we're aiming toward the trash can. Prime the line before attaching it to the white port on the other line. Okay. That went a little too fast. And then we will grab our alcohol swab and cleanse the Y port on here. Before connecting it to the patient, we will prime this line as well. So we'll clean it for about a minute, let it dry, connect it. Okay. And then we'll open this line and let this prime as well. So we'll open this line a little bit. And we want to make sure that the drop factor for the antibiotic is 100 drops per minute. So we'll stand here and count the drops at about 100 for a whole minute. Once it's been a minute, then we can close the clamp for now and ensure that this one is running at 38 drops per minute as well. Clean off both ports connected to the patient. Ensure the patient feels all right. And that's it. Once done there, I will remove my gloves and perform hand hygiene.